cognizant of your time. And so I want to welcome everybody to this month's meeting. And on the agenda today, we will have obviously the introductions of any new members who are joining us for the first time. And then we'll have the announcements, and then we'll have a presentation from our guest speaker today, Dr. Loud, and then we'll talk a little bit about the progress of what we're doing as a network. And then we'll speak a little bit on the early adopter process, and then as well as the systems map. So again, welcome everybody. And if there's anyone that wants to introduce themselves, please feel free to do so right now. Otherwise, we'll go ahead and get started. Heidi, I can't see the people. If people have their hands raised, I can't see. So if there's anybody that has their hand raised and wants to say something, please just,
Yeah, no, I don't. Nobody has their hand raised.
Oh, okay, all right. All right, well, go ahead and get.
Oh, is it Shale?
Hello. Yeah,
Yes.
it's Shale. How are you, everyone? Happy
Good.
Friday.
Happy Friday.
Do you want to introduce yourself and share a little bit of the work that y'all are doing in this space?
Sure thing. Am I on camera?
Yes, we can see you.
Okay, I don't see myself, so no worries. Yeah, so this is Shale. I'm founder CEO of Rainbow Health. Previously, my other co-founder partner Ayushi had joined this Zoom call. I just hadn't had a chance. We started Rainbow Health about 2.5 years ago here in Houston. We do provide a platform for doing care coordination, care management for anything which is at home or in place delivery of care across different acuity of the patients, from crisis response to episodic to longitudinal care. And we do a lot of underserved screening events in greater Houston area. We are looking for CHWs who continue to participate in that activities. We literally have every weekend at least 2 or 3 events going on in Houston. We aim to expand our services in Arizona, Oklahoma, and Florida, and some of the other states. Very excited to participate and know the other champions in the community here, and continue to strive together to get the better outcomes in greater Houston area. We do have some plans for focusing on certain areas of maternal and child health related activities, having foots on ground. So we'll be sharing more details as we come along that journey along with our vision. So thank you, and great to meet you, everyone.
Nice to meet you, Shale. Thank you and welcome. Thank you for joining us today.
Thank you.
Okay, we'll move on to the open forum announcements and updates from the network. This is a great time to share what you've been working on, what's underway. So if you have any announcements, please feel free to share.
I'll share. Hi, Maggie. Hi, everyone. This is Tiho Pham from Harris Health System. I've been just still living on this great high. Harris Health System just completed a CHW system training this past Wednesday to all of our CHWs across the system. So CHWs in correctional health, in our homeless services line, in population health, like the food pharmacy, in our 2 hospital pavilions, Bentab and LBJ, and the topics we were able to discuss, and that was part of kind of our commitment to the Health Equity Collective. Was we had presentations from South Texas College of Law on health, on medical legal partnerships and advanced directives. We had a presentation on health equity, and then we also had a panel of CHWs really giving us their voice on like what they see as being, you know, health equity and what are some challenges and barriers and what are some successes. And then we also had a presentation from the Houston Food Bank with food and nutrition through a cultural lens, and a little fun activity on how to kind of create healthier meals that are culturally relevant to our patients. So that was super exciting. It was for DSHS CEUs, and so wanted to share all that with you all, if in case you want to spread the excitement and potentially do that for your own teams.
Thank you, T. Yeah, T and I met this week, so I had got a sneak peek of some of that. So thank you for sharing. All right, is there anyone else that has an update or an announcement for the team?
I have an announcement, Maggie.
Okay.
I'll go ahead. Hi, this is Rosalia. So there is currently going around a statewide community health worker training needs assessment. I'm putting the link in the chat. This is actually being spearheaded by the Office of Border Health, but don't let the name trick you. It's for the entire state. It's for community health workers. So if you can forward that to any community health worker, you know, the link, it's both in English and in Spanish. They just have to click it. And the deadline is November the 13th. And this information will go back to the state so that they can encourage training centers to develop different types of curriculum based on need. So if you could, the more input they get, the better. So we definitely want community health workers to direct what training they feel like they need.
Thank you, Rosalia. Thank you. Yeah, we actually have dropped that link for the needs assessment in the chat. And then we also have just a slide on it. So towards the end, we'll share that as well. So thank you, Rosalia, for that update.
Sure.
Okay, any more announcements, updates from anybody? Okay. All right, so we'll move on to the next thing. So we've got some community health worker opportunities that have been shared with us, and we wanted to pass those along to the network so you can share widely. Memorial Hermann has a CHW job opportunity, and it's in Humble, and that's the link right there. So please feel free to share if you're looking to hire one. You know, if you know anybody that's looking to hire one, please share. And then the Houston Recovery Center also has a CHW opportunity, and the link is also in the chat box. We're dropping that in the chat box, but it's also on this slide. And then the School of Public Health, we have a CHW opportunity. Heidi, have we already hired for this opportunity? I think we've already hired for this. Or are we in the process?
It's in the process of hiring.
The process. Okay, so we're also happy to share that we're going to be hiring a CHW for our department. So looks like 3 opportunities here. So we're moving on. That's something that I'm happy to share with the network in general. And then this is what Rosalia was talking about, the needs assessment. We've dropped the link in the chat as well. So feel free to click on it and share with community health workers so that they can do the assessment. And then on the advisory committee, I think that the deadline for that has already passed. However, we're encouraging the public to attend the Community Health Worker Advisory Committee. And I think Joe is on the call. If you can speak a little bit about this, Joe, would appreciate it. I don't know.
Hi guys.
Hi.
I'm sorry, I'm at another event. Of course, as a community health worker, you're always in the community doing what you can. But absolutely want to encourage everyone to be a part of the Community Health Worker Advisory Committee meeting that's happening on, I believe, October 27th at 10 a.m. If you go to the DHHS website, you can find that information. I believe on the slide that she has up right now, there's a link there if you'd like to make public comment. If you have any questions, any comments that you would like to make, please, please, please call in, go on the Zoom, make sure that you have something to say. We can't make advances for CHWs without your comments, without your information, without your participation. So we want to make sure that we're doing our best as the committee members come together and make decisions, but we want to make decisions that are meaningful and make sense to the CHWs Texas-wide. So again, I'm Jomitra Hawkins-Sneed, one of the advisory committee members. Like she said, the advisory committee applications have already passed, but there are others that will come about for 2024. So be on the lookout for that. I will send that information to the collective as well. So you have that in advance. There needs to be more diversity on this committee. There needs to be more voices on this committee as well. There's not many from Houston. I think I'm the only one part of the committee. And I don't think in the past that we've actually had great representation either. So would love, love, love for you guys, your voice to be heard and things to be able to move in the direction that we needed to as a collective for the state. Thank you.
Thank you, Joe.
Jo-
And so go ahead, go ahead, Heidi.
I have a question, I think maybe for Joe. Sorry, Maggie. I'm wondering if that group is going to be having any conversations about the plans that are in the work about the administration of the CHW related policies that were passed. Because I have a lot of questions about how those policies are being developed by the administration for implementation. And I was wondering if this group will be having any insight or conversations informing the policies that are reimbursing CHW work.
That's our role. That's what we're supposed to be doing, advising legislation on what's next for CHWs. This group is supposed to have the ins and outs of what's happening for CHWs in Texas. So one of the things that I would recommend is to be a part of this meeting and make that public comment. The leaders that are at DHHS that govern this board, they don't know what's on your mind, or if those are questions that are circulating. So I think that the best option is to make sure that we are present and have those type of conversations. This committee only meets every quarter. And we're supposed to go back and forth with information and details via email, but it has been very quiet because we don't have a whole bunch of participation from the community to engage and do things. So I would greatly encourage, if you have questions like that or information that you want to share about your organization or what's happening in Texas, please, please, please make a public comment and be a part of this meeting.
Thank you, Joe. Thank you. Rosalia, you have your hand up.
You're on mute.
Sorry, just to tack on what Joe's comments was as a past advisory committee member. She's right. The advisory committee kind of like dictates what's going the agenda. So we would always, there's usually some kind of presentation. Sometimes it's a feel-good presentation from a community health worker program in the state, and that's always, nice. But regularly we would ask for any one of the other DSHS departments to share their knowledge. So definitely advisory committee members can ask, the public can ask for having these types of presentations. And while I was on the advisory committee, those were usually most impactful because they would have to answer the questions. They're not that they're witnesses, but that's kind of the format. Just as if you're presenting to legislature, because all the comments, although it's a very open format, it is for the record. I mean, it's part of the state record. And there are other ways to participate in as a committee member. The committee usually has working groups. So you can volunteer to be on a working group. And the only rule is that you have to have one advisory committee member to be on the working group. But that working group can be as big as you want, and it can have different experts on it. And it was one of those working groups where we came up with the financial kind of like the financial template that actually led to the legislation that is in place today. It all started within the advisory committee working group. So definitely, one, encourage people to just sit in without any public comment, and also to participate in a working group if you're so inclined. And you don't have to be a community health worker.
That's phenomenal. Thank you all. I think this merits a little bit of strategy too, of how do we hold up all those shared learnings of this group in that space for the state.
Yeah. All right. And then the next announcement or update or initiative that's coming to us also is going to be shared by Joe as well. Joe is bringing a lot to the meeting today. Joe, this is on CASPA. You and I had visited a little bit earlier this week. So if you can just share with the network about this initiative that's coming to us.
Sorry, guys, I'm trying to toggle in between this event. I'm actually at Texas Southern right now for an event that they're doing with CHWs. It's an opportunity to work on really engaging the community. So the Texas Southern University Center for Transformative Health is working with the City of Houston as well as the Mayor's Office, Complete Communities, on really assessing what the health of Third Ward really looks like after COVID. There has been a lot of concern about those that were affected by COVID, whether they were infected or if they had family members or, even economically affected by COVID. There have been some changes in health, whether that's mental health, physical health, emotional health, all of the above. There have been changes, but we have not been able to document those things and really find out what that looks like. So as the TSU Center for Transformative Health, they come together with the city to figure out what that really looks like. But we need feet on the ground. We need people to actually go out and do these assessments and go forward. We're hoping to go and talk with about 210 different residents or different homes to really figure out what their insight and what their approach is on their health, and really looking at their perspective of health as well, because most people may perceive themselves as healthy, but also have these ailments and things that that will prevent them to achieving ultimate health. So we want to make sure that we have feet on the ground to do this. There is a small compensation for those that can go out, very, very small. But I think the opportunity to be enriched with the learning, get the education, and also the engagement with the community, it really gives another perspective to the work of a community health worker and how we can bridge those gaps between healthcare and community. So I invite you guys out to be a part of this. If you are interested, I can leave my my email address in the chat, but I believe there's also a sign up form that I can also put in the chat if it's not on the flyer already. But there's a great opportunity to be engaged and involved in this community work. Thank you.
Thank you, Joe. I actually have access to some trusted health ambassadors that we trained this past summer, that if you're leading people that will actually be on the ground, I can connect you so that way you can have individuals that might be interested in participating in an event like this. So I'm happy to link you with that. And then also some CHWs themselves that have been trained, they might be also interested in participating. So happy to link you to that.
Absolutely. And I did forget to mention, this is for next Friday and Saturday, October 27th and 28th. It will be mostly all day on Friday and half day on Saturday. So please, please, please share this information. If I'm hoping that the collective will actually send this out in an email to you guys with this information, so you can share it with your networks.
Absolutely. Thank you, Joe. Thank you so much. Okay, now we'll move into the part of our meeting where our guest speaker will present. And I'd like to introduce you to Dr. Grace Loud. And she will be our guest speaker for today and making her presentation to us today. Welcome, Dr. Loud.
Thank you. Thank you so much, Ms. Green, and everyone else for having me here today to talk a little bit about the work we've been doing around the Advocacy and Capacity Enhancement Project, leading to some trainings.
Dr. Loud, I'll stop sharing. So did you want to share your presentation and I stop sharing, or would you like me to just advance it for you?
Yeah, you can advance it. That's fine.
Okay.
Thank you so much.
Of course.
All right. So I just wanted to give a little bit of background about myself. I'm here, I'm a faculty member in the Department of Social Work. I've been here now for about 12 years. And since I've been here, my focus has been about health and wellness, particularly around sexual health and minority health disparities. So between those two intersections kind of set the trajectory for the types of things, service projects or research projects that I've been a part of. One in particular, just wanted to highlight some of those that speak to community engagement. I work with the TSU SHAPE Initiative. It's a grant-funded program focused on sexual health. A lot of the work that we do is in collaboration with community partners. We've be at SHAPE Community Center, Q Learning Academy, and the Fifth Ward community in areas of greatest need to bring clinical services, sexual health, STIs, mental health, substance use, wherever it's needed. For several years, I also served on the Community Engagement Corps, which is through TSU Center for Biomedical and Minority Health. And I partnered with a few people on here in that capacity, where we kind of talked a little bit about some different initiatives, how to do more in the area of community health workers and just be a source of support. And I know that both of those programs are offering still, education and engagement. Just real quick, I wanted to highlight that for our TSU SHAPE initiative, really proud to note that we've had at least 4 of our staff members who became licensed community health workers because they saw the value in the work that they're doing and how that integrated. And also that the Texas Southern is now a certified continuing education training provider. And so they're offering quarterly or monthly, they're offering free units for a lot of different people to come in and just get that education. So this leads me to the work we're doing with the Center for Civic and Public Policy Improvement. Really glad that they invited us on to kind of be a part of this and to see what we could do around the trainings. So next slide, please. So what we're going to cover, just talk a little bit about the whole trajectory and how we got to where we are right now, talking about the plan and review, how we developed the framework and where we envision going from there. All right, so just starting off, Dr. Haley reached out and kind of spoke with everyone about, what the plans are with regard to the grant. So we started talking a little bit. We knew that the focus was advocacy. And we spent a lot of time talking about what does advocacy mean. So for me, being someone with a background in social work, we know that it can look like a lot of different things. And so we wanted to get a sense of how or others thinking about conceptualizing advocacy. So that was one of the key things that we wanted to talk about. With the trainings, we wanted to know what was already out there. And so we started compiling a list. And thank goodness for Rosalia being a part of this effort, because she's so well versed and knows about so many different curriculums. We were able to pull things off the DISH website, as well as other entities with regard to all of the trainings. I think we may have had well over 230 titles, different trainings. Now, the thing about it is that you can get the titles, but you may not also always have access to the curriculum. So there was a lot of kind of, I should say, hodgepodge, in the sense of you've got the titles, but you don't really know what they were about, but you can kind of assume. So but everything really was a version of advocacy that I think was important for us to kind of take a look at and consider while we were in the planning stages. Looking at the literature, thinking about the relevant literature, the different databases that we would use, the academic literature that we wanted to kind of include. So we started collecting that, trying to identify some gaps. And also wanted to think about some key data sources. So I know that the Texas Research to Policy Collaboration Project, the Texas RPC, which I've went through a few times, it's a wonderful data source. Also the CDC, MHP Salute, and others that we definitely intend to utilize for like supporting the training, if you will. I hope that makes sense, but to support the interactive components. And then finally, we just came up with a draft curriculum outline and syllabus that we would use to kind of set the framework for us once we got ready for that. Next slide, please. All right, so for data sources, we basically used the key sources that were provided. So I think Ms. Heidi forwarded some key informant interviews that were done through a qualitative methods course that included 13 key informant interviews with informants throughout 5 different regions in Texas. And then with the most recent project, the team was able to conduct some more interviews with 4 key leaders in the field to kind of get their perceptions about the field, needed resources, what they thought maybe trainings and best practices, anything that they wanted to share based on their professional experience in the field. And then they also conducted a series of focus groups with at least 20 community health workers of diverse backgrounds who shared their perspectives as well about how they felt with regard to the work that they do, how they engage with others, maybe how others perceive the community health worker role. So it's very interesting to kind of read through all that. And the goal was to kind of pull it together in a way that made sense according to the objectives of the study itself. Next slide. So one of the first things we want to do is get a sense of how do people think about advocacy when they do, well, how CHWs engage in advocacy. And as you can see here, these were some of the key phrases that popped up around trust and being able to leverage and utilize that trust, being a voice, engaging those for what's right, and engaging those who may have power, and being able to recognize the fact that, you know, there may be privilege or power that's not being properly addressed. And then, you know, just looking at this, someone said that they look at advocacy as basically the full spectrum, being able to not only be an advocate for yourself, but be an advocate for others in the community, and also be able to take those concerns to the highest levels as needed. So it was well-rounded. Advocacy at all levels. I looked at it as the individual versus the structural level. So Ms. Green, next slide.
Okay.
Thank you. So here was where we started trying to make sense of everything. And like I said, the level of focus that I saw come up most either dealt with what was happening at the individual level or what's happening at the structural level. And so one of the things that the study asked people, what were some of the most prominent skills that they saw best benefit community health workers and or the work that they do? And of course, people talked about the interpersonal aspect, the need for empathy, the ability to listen actively and to digest information. And most importantly, and I say most importantly, there, all of these were important, but everyone was pretty consistent in saying that there had to be an innate passion for the work that you do. So that came up quite a bit, just the importance of having a passion for what you do, because if you really don't have a passion for it, you'll probably start to experience some of the negative aspects in terms of burnout or whatnot, than others may. And then other issues that talked about, of course, was being able to bridge and serve as a bridge. I think that speaks to the trust that was highlighted. Good knowledge around the various social determinants of health, social determinants of health and inequalities, and thinking about the way to leverage social networks, being familiar with policy, that all of these things are important when you are working on behalf of others. Some of the most common barriers, the first and foremost at a structural level, everybody recognized the role of compensation and what that says, where we are, where we should be, just, so that's first and foremost prominent in terms of structural factors. Then thinking about career pathways, sustainability, being able to get in and see a way to advance professionally was important. And then at the individual level, mental health and emotional support, confidence, and being confident in spaces where maybe community health workers are not normally viewed by others. And a lot of that had to do with people not being as familiar or knowing what does a community health worker do, what kind, what's their function. So sometimes people have an idea of it, but they don't really know. And so that affects the relationship or the planning or what the expectations are. So then one of the things we wanted to ask about were resources and training. What did people think was needed based on their professional experience, their personal experience? And some people said they thought leadership development, endowing community health workers with the confidence and the skills needed to be assertive and know when to be assertive, to have the skill set to address mental health, and also for themselves, because there was understanding, how can you help others you have to put, someone said, put your own mask on first. So that's what I think about that. And then being in a position to educate others in a way. Now, I from someone who's in social work, I kind of like to be a little careful with this, because a lot of times when you think about oppression, it shouldn't be the oppressed person having to educate, the dominant. But in this instance, we're talking about being able to have the skills to know your worth and to be able to maximize what it is you do, and which in turn can educate others about the role, the function, and how it benefits others. So that's what I think about return on investment. And then also workforce development. So we pulled all this together to kind of see what can we identify as key things to make sense of all this, to lead us forward to the next level. And here, if you will, Ms. Green. Thank you. So we tried to narrow everything down. We conceptualized all of the information and resources needed, kind of broke that into different groups. So leadership, the ability to assert mental health, professional capacity, then moving into the structural level, where we looked at not just put CHW value, but its value in terms of being able to educate others, value as in being able to provide that information that supports a return on investment, and then workforce development. And we kind of narrowed that down into two dominant things, thinking about the dual identity aspect. What does it mean to be a member and or integrated within the very same communities in which you serve? What does that mean in terms of leadership, the ability to assert oneself, knowing how to balance the mental health aspect because you are a member of the very same community, but you're trying to reach a destination. And so recognizing that there's a balance there, and also in one's own professional capacity. And then here, the other one was about educating others. So looking at that from not just educating others in terms of how you do what you do, but also how it benefits the agency in the long run. There's a lot of literature out there that talks about the return on investment of community health workers being in the field, doing what they do, and how it saves the agency money over the long term, or it improves health outcomes over the long term. So that's what I think about when I say educating others, and the importance of being able to have the skills or the tools to strengthen your professional self so that it can demonstrate that. I like to stop here and ask if there are any questions. Happy to tell you, don't have to wait to the end.
I don't really have a question, but I just have a comment. Just the dual identity aspect of this is something that has been noted several times for the community health worker. They feel that they're having to do like multiple things at the same time, advocate for the community and for themselves. And this is really an aspect to which I'm so glad that you brought it up, because there needs to be a lot of education, organizational education on the value of the CHW, as well as them themselves knowing what their value is. So thank you so much for bringing this up. It's awesome. It's just a comment.
Okay,
you know.
thank you. I'm glad to hear that.
Yeah.
All right. So then,
I have a question.
yes.
Sure.
Yeah, you touched base a little bit about the social determinants of health and how community health workers are well positioned at an individual level to talk to the patients, members in the community. Can you see to what extent the training is needed to community health workers to really understand the social determinants of health? Because it's not just about documenting the answers to the questions, but addressing it beyond that. And everybody tends to have slightly different version of their own assessment. So is there any specific educational activities that one needs to do in order to focus on social determinants of health, how CHWs are going to engage the members?
So first, and thank you for your question. So first, let me make sure I'm understanding what you're asking. You're saying where the boundaries in terms of understanding what a CHW would need to know around social determinants of health? Is that the first part? Okay.
Yes, what they need to know, and then what's the method by which we are educating that everybody might use different form of assessments even for the same social determinants of health.
So what, because this comes from the data that was provided from the key primary sources as far as what they thought was important for community health workers to know. And so based on the way that I interpreted that information was that it was an understanding of the inequalities that people experience. So understanding the connections between how something can present itself, but it's a feature and a function of multiple things at one time. So that was the impression that I got when I read the information. Now, based on what I know in terms of how to talk about or train or teach, my recommendation would be to use a particular framework of some sort. Like I like to use, I like to talk about I'm sorry, I'm looking at Dan. Okay, thank you, Dan. And so looking at here, the intersections, if you will, of what it means to be in an environment that's like it interacts with different, different aspects, and it looks differently for everyone. I think that would be the most useful way. Then there's literature that we would use. So when we go to this databases, you can pull case studies and whatnot to kind of talk through and work through some of the different ways to think about the interaction between different categories. I hope that's helpful. Did I get that, Shell? Is it Shell?
Yeah, I think having that framework or some of the case studies, which always helpful. I think sometimes what we found is, they are very much into doing a data collection part while they're interacting with the patients, but solving those problems is a long-term, approach. And educating community health workers that long-term approach and is very much essential. So I was just looking for, is there any identified areas of education that you guys have thought of when it comes to really solving the SDOH problems, which is not going to happen in one meeting or one session with the patient. So CHWs tend to just focus on documenting the assessments and not on actually solving longitudinally those problems. So maybe that's where some more educational framework or some more guidance might help. And I was looking for any pathways to educate them in that regard. So I think it's kind of making sense what you said. Case studies might have some of that information, but it might be a point to note that maybe how do we really focus on solving the SDOH related problem areas than just documenting the problem areas with the help of CHWs.
That's a good question. To me, it feels, I mean, to say solving it, I don't know. I guess the first step to solving it would look at, you have to be familiar and understand it. That would be my first step. And like you said, recognizing that it is for the long haul. It's not something that's just going to, you can just go in and do it. But I think I hear what you're saying, to do something to a little bit more than just take note of it, is what I think I'm hearing you say. And I do think that's important as well, to be able to go to the next step. Okay.
Yeah.
Yeah, likewise. Thank you.
Dr. Loud, one thing, definitely Dan has some great expertise here, and just another comment, Shale, I know you're new to the Health Equity Collective. I think part of the benefit of connecting the CHW conversations to the broader work of the Health Equity Collective and the many aspects of like systems change around social determinants of health and health equity is a real opportunity to get at your question. Is kind of like what Dr. Loud was talking about in her presentation of like, there's more on the systems and structural end of a responsibility where it's not really the it's not the CHW's responsibility to solve social determinants of health. It's all of our responsibilities.
Right. But that's help.
No,
that's
of course.
helpful.
Of course. I'll keep this short. Sorry to take so long. No, of course, the solving the problem is almost like a multidisciplinary team approach that everybody is responsible for that at the end. But I think I was trying to focus on educating the CHWs that how that is a long-term approach. And if CHWs are trained in and around that long-term approach, just like the case managers would have that information and multidisciplinary team would know how to solve that in a longer run. But CHWs more often I've found are unaware of beyond documenting the problem areas in the first place. So that was just an input so that, I think I'll look into Health Collective's resources and information as I'll continue to participate more often, but happy to look at some of the data and connect to other folks. Thank you.
Hey, this is Sean Haley. How are you guys? I'm on the move. But Dr. Loud, one of the things I was thinking about as it pertains to this particular question is that the same way you're deriving the conclusions and kind of creating the training, right, from what we've learned through the course of our interactions around a specific question, this question that was just raised reminds me of that. And to me, it's nuance is really the answer. I love how you and Dan, I can't see because I'm driving, but I hear you guys. And how you all talk about the framework for education is one aspect of it. Clearly, there have got to be different approaches because all CHWs aren't necessarily working in a hospital environment, but all CHWs may need to have greater access to understanding around the social determinants of health and kind of how they can impact it within the realms within which they work. And so I'd like to just kind of, Heidi, I think it's a great place to put a pin in that question and think about how do we ask questions to kind of take this to the next level in terms of, what are the other areas maybe where there is not the training in place to kind of do what we've done to get to this point of what Dr. Loud is presenting with regard to that specific question that was just raised, because maybe there's not enough out there, right? Or maybe there is and people don't know how to get to it. So just wanted to add that it's, you know, it's a quality question that's asked, but it's nuanced based on where CHWs are having impact, you know, within which environments they're working, et cetera. But I think it's definitely worth doing additional research on.
Can I say something? My hand is up. I want to add to the conversation.
Sure.
I just want to say that I think the education and the framework for the education is there. What is not there is the opportunities for CHWs to go upstream. You know, they're treated like bean counters. They're treated, you know, as disposable entities and organizations to carry out the work of other people. That's how they're treated. And so we can talk to them about, you know, social determinants of health. We can talk to them about how all these things intersect. But the reality is, when you look at nonprofits and you look at groups that work with CHWs, they're hopping from one grant to the next grant, one funding pot to the next funding pot, one opportunity from the next opportunity. And they're not sitting at the table with CHWs talking about why we're doing that project. Why are we choosing that project? What are we going to do for the next 5 years? And so it's interesting, you know, it's like, you know, we tell people they have power and we got to do this really important work, but their lived experiences tell them otherwise. And so I think the CHW's understanding and practice is a reflection of organizations and how the systems minimize their approaches and their input. And so they're not worrying about these other things. They're not being paid to worry about these other things. They're not being supported to worry about these other things. And in any system where none of that is happening, then the things CHWs are going to be these change agents instead of the bean counters in which institutions have made them financially, structurally, in all ways, then it's not an education problem, right? It's a systems problem. And the CHWs didn't create the systems, they are impacted by the systems. We're the ones who create the systems on these calls, right? So I just want to, you know, I don't know if it's level set, but I think our institutions are not looking at the social determinants of health in any real ways. I mean, it's on our website and we may fundraise for it, but that's not what we're doing 9 days out of 10.
Thank you for that, Doctor. And I mean, when I go and I'm looking at what the people had to say, you know, what we said was it's important for people to be familiar with it, but what they felt that was needed was for people to value the CHW role, to show appreciation to the work that's being done, to understand the nature of the work that they do. No one said, I want to learn more about, you know, this particular, you know, issue, but they did say they want resources, they want to be supported mentally. So I think from just I guess the best thing I can offer is that, you know, all of these things are important, but if we had to prioritize it, I guess the best way would be to go with what people actually had to say and share in terms of what they thought was important. Just something to think about there, but I am pulling all the notes. And I agree. I mean, it's definitely some nuanced questions here, but a lot of what folks were paying attention to were more so just, I guess, around worth. So, Ms. Green, if we can go to the next slide, please. I just wanted to show here how the specific competencies. So our goal next was to take some of those concepts, the constructs that were most pronounced: mental health, around CHW value, workforce development, and try to align them with the competencies. And so we identified about 5 out of 8 competencies that we thought worked well with some of the things that were highlighted in the discussions, the focus groups, and the interviews. And so for me, the goal was to, you know, which of the practice, I call them behaviors or practice behaviors associated with each competency, maintains the focus on advocacy, crosses multiple constructs, has some applicability to both things, and it's actually feasible. I know myself, things can get like way big in terms of conceptualize. So what can actually be done in terms of a training And that was kind of the feasibility aspect here. And so we kind of outline and put everything together. And you'll see how they're put up in terms of asserting self under interpersonal skills. But then we also have a little bit under advocacy. So this was just kind of pushing and meshing everything together for the constructs and the competencies, because I know the goal eventually is to see what can be submitted to the Department of State Health Services so that it could potentially be certified. So if we move to, oh, I'm sorry, that's showing up as blue on my screen.
The screen, yeah.
I'm sorry about that. So here we are presenting the first series, so theme 1, which is a focus on the membership and integration within the same community in which you serve. We identified 3 potential trainings that align with this one theme. And so we, first and foremost, we had professional CHWs and leveraging multiple identities. And so with that one, we've identified some learning outcomes, which is number 1, looking at the inherent value associated with diverse identities and how that supports the community health worker role, being able to articulate personal strengths, experiences, and how these strengths should or can be utilized to influence engagement. And then looking at the specific instances where lived experience are leveraged for positive outcomes. So these are some of the key learning outcomes that we hope to be able to accomplish in this particular training. And then from there, we're using the literature to have some specific training outcomes, key things that each trainee will be able to do or say they've done throughout these trainings. So we're estimating about 60 hour-long trainings, but I know Rosalia said they could be a little bit longer. And so it just kind of depends on as it continues to formulate with the interactive components. Then the second part was mental and emotional self-care. So we had a lot of people talking about the importance of that. And so we've identified the learning outcomes for that, being able to understand a diverse spectrum, normalizing mental health, being able to utilize and understand the difference between assertive and non-assertive engagement and communication, and then coping, building one's own repository of coping skills. Then our third one, managing up CHW self-advocacy in the workplace. And so here, the goal is about leadership, being able to identify leadership, utilize leadership skills in engagement, professional communication with others, being able to highlight one's own professional contributions. So this is here we start to kind of think about that CHW value and how the actions and the tools you use can be a way to demonstrate to others or educate others, if you will, about the value of the CHW role and what that's all about. So any questions there? Those are the first 3, what are 3 that go with theme 1. I'm sorry, you can't really see it that well, but I think Ms. Green, could we send this out if people want to be able to
Yes.
see it?
Yeah,
Okay.
absolutely. We plan on sending it out right after
Okay.
the meeting. Mm-hmm.
All right. And then for the next slide here, theme 2, which is about strengthening the professional self that can also contribute to educating others. And so here we call it, and courtesy, I think this came from Dr. Haley, make it make sense, promoting and strengthening CHWs throughout the workforce. And so here the focus is on kind of bigger tools, understanding and working with policy, and recognizing the value of engaging in legislative efforts, being able to use some tools to be able to do mapping techniques, and also how to leverage. Well, I mean, I expect many CHWs know where to find resources, but how to recognize that resources are wealth. And not everyone can find and leverage resources the way that some people in some different disciplines can, and understanding how to leverage that in a way that speaks to the uniqueness of the community health worker role. And so with these themes, this brings us to a total of 4 trainings that we're going to have, everything based on adult learning principles, primarily recognizing that it's not about just sitting up and being a passive recipient of information, but being involved. So our expectation is that trainees will be hands-on, really using their lived experience, their previous experience to help make the training a lot more interactive and engaging. So in other words, being respectful of the backgrounds that people come with in each of the trainings so that everyone can learn and kind of benefit from that from one another. And so just in closing, our next steps, we should be wrapping up. And I said, I appreciate the feedback. And so we should be able to integrate, make some additional edits, be wrapping up the actual, the guides along with the accompanying PowerPoints that'll go along with this. So the expectation is that if someone wants to conduct the training in person or virtually, it shouldn't matter. They should be able to kind of work within any setting to make it work. And then also I know the team is working on pulling the tool kit together. So I think it's supposed to be packaged together and made accessible for everyone. So that concludes. If you have any other questions, I'm happy to try to answer those.
That was phenomenal. I mean, it was really a great presentation. Thank you so much, Dr. Loud. I have so many, I think the people have a lot of probably comments and questions, but I know that we're kind of running out of time. So if it's okay with you, we'll probably reach out to you with additional questions that have been maybe placed in the chat and just send those to you and comments on that. But this has been phenomenal information and just really great presentation. Thank you so much.
My pleasure. My pleasure. Thank you.
I know you're trying to wrap. I just have to say, we're just so excited that we had a chance to partner with Texas Southern University through the person of Dr. Loud to really pull this together. So thank you so much for the work as we continue to work forward.
Yes, yes. Thank you both for your vision and leadership. This is, as Maggie said, phenomenal. Really, really excited about this. Thank you.
So for the rest of the network, we had a few more things that we had wanted to cover, but we will go ahead and send the presentation out to you all, along with the links for the resources that were shared in this, and also this presentation that Dr. Loud has just shared with us. We'll send that out to you so that way you can have access to it. But I just wanted to wrap up by saying thank you so much for joining the meeting. And Dr. Loud, thank you again for this wonderful presentation.
Thank you. My pleasure.
All right. Thank you, everybody. Bye-bye.
Bye. Thank you.
Thank you.